All right, the subject is the big tax and nationalization healthcare bill put up by the Democrats in the House and Senate. Here to respond for the Republican side is Texas Senator Kate Bailey Hutchison. As always, Ms. Hutchison, we welcome you back to the Kudlow Report.
Thank you, Larry. Thank you.
All right, you wrote a hard-hitting piece in the Houston Chronicle, and I want to work off that. But let me just ask you first some breaking news. Our own Hampton Pearson says that this big, gigantic tax increase to finance it coming out of the Charlie Rangel Ways and Means Committee is dead in the water in the Senate. Can you confirm that or not?
Oh, if I can confirm anything, it should be that. Democrats are balking at it. It is a terrible idea. So I hope that it is dead in the Senate.
What's your biggest beef right now with what's coming out of the Senate on health care?
Well, it's a big government takeover. We are looking at huge tax increases, even cutting Medicare and Medicaid to providers. Hospitals and doctors will be cut in order to pay for this big one-payer system health care plan that is going to take over all of the private insurance and choice in our country. That's for starters.
Does the government insurance plan, which is the centerpiece of what Mr. Obama seems to want, do you think that will pass or fail?
Larry, I think it will fail, but I don't know. They have 60 Democrats, and they are really putting a lot of pressure on the Democrats, but the ones who are thinking are balking. They're saying, wait a minute, you're talking about another $1 trillion to the deficit. You're talking about a huge tax increase on individuals. You're talking about cutting Medicare and Medicaid providers to providers. And what are you going to get for that? Fewer choices and lower quality health care.
We're going to put up on the full screen this incredible bureaucratic central plumbing chart. Look at this thing from Mr. Kevin Brady of the House Republicans. I guess he's on the Joint Economic Committee. That is an unbelievable chart. It is it's incomprehensible. But let me ask you this. Senator Coburn, your distinguished colleague from Oklahoma, said, okay, if we pass a government insurance plan, shouldn't every Senate and House member have to sign on to it? That becomes their plan. Do you think they would do such a thing?
Well, of course, he put that amendment on in committee. 45 amendments were put up in committee by Republicans. 2 passed, and that was one of them. He was making a point and saying, okay, if you think this is so good, let's put everybody under it. Let's put the Congress under it, and let's just see how everyone likes it. Well, the committee adopted the amendment, but if you think that has any chance to stay in this bill, of course, I have a road to sell you in Alaska. I mean, come on. So, of course, no one is going to want to be in a plan that has no choice of doctors, that starts to become the Canadian system, because if you have that public government plan, you're going to start crowding out the private plans, and you're going to take out of Medicare and Medicaid, so you're going to lower the quality of those as well. Your hospitals are now going to start getting in trouble. Rural hospitals and the DISPRO hospitals, which are your urban hospitals that teach medical students, are going to be cut. What are we thinking? It's incomprehensible to most of us.
Just in the last few moments here, you're basically saying in your editorial in the Texas paper, and I believe you said this before, people go into this government insurance plan, they're going to lose their own insurance plan, and they're going to lose their choice of physicians. Is that true?
Well, it is, and also you're going to raise the cost of any private health insurance that would be left, and they even are talking about taxing that.
Why the heck don't we just change and save Medicare from bankruptcy? Wouldn't that have been a more intelligent place to start?
You know, Larry, there are so many reforms we need. We need more access to health care, but we could do it by offering health care plans by small business, by offering small business incentives to cover people, not taxes.
All right.
That's what we ought to be doing, is more free enterprise in this whole equation.
Senator Kate Bailey Hutchison, thank you ever so much. Sorry, we're a little short of time because of the fast breaking news on CIT. You may have to grapple with that tomorrow. We thank you very much for coming back on the Kudlow Report.
Hey, great to be with you always, and Kevin Brady's great. That chart is wonderful.
I know, boy, that really says it all. What a bureaucratic, central planning, Soviet-style mess. Pardon my editorial. Coming up, much more on